Okay, so good morning, everybody. My name is
Mhm.
Kathryn Watson, and we want to welcome to Scrubs and Stethoscopes. It's the Nurse Handbook podcast, and I have Ashley Roberts here today, and we're going
Hi.
to be discussing what it is to be like the mastering at the bedside with nursing. So we have different questions we want to go over. So my question to you this morning is, what are the key habits or routines that you recommend to a new nurse that should develop in like the first few months on establishing their job and having that strong foundation?
Yeah, so I think sometimes it can vary a little bit depending on what shift you're doing, but I know most of my nursing at the bedside has been through to 11. And what I found to be key to a successful shift was taking a really good report at report time. And then as long as nothing was urgent, I like to quickly look at all my labs. I want to know what's happening with my patient today. Is there something off? Is there something that, didn't get addressed during the day because it was crazy? And, what is their potassium if they're throwing a lot of PVCs, things like that. And so that when I walk in that room to first introduce myself to my patient, I know a little bit about them and I can sound professional and trustworthy when I'm assessing them. And then the next thing, and this is probably the most important thing, is you have to assess the patient thoroughly. That is how the doctors are going to know what's going on. That's how we're going to make changes in our treatment plan to get our patient better, to leave the hospital. So I think those are probably the two most important things as a new nurse is really getting to know your patient on paper and then walking in and really assessing them thoroughly.
Yes, I agree. I recommend to new nurses is that you have steps that you want to follow. And I
Mm.
wrote them down somewhere. Oh my God. Add them. Either way. So I would always say is like, yes, you get a thorough report, but
Mhm.
sometimes some nurses I found don't know how to give a good report.
Yes.
Sometimes they go into things that don't even matter.
Yep.
So I usually tell everybody is that we get this piece of paper that has all the patient information on it already. And that's where I like to just kind of follow along because we practice with reports to say what's the patient's name, what's their code status, allergies, medical history, and like their vital signs or anything. And that's all
Yeah.
printed out in front of you. A lot of the EMH, like the new like medical records have that printed out. I
Yes.
do teach to have a flow sheet that everybody has their own that's going to be made up. Because the
Yeah.
first, I'd say, few months is that you're with the preceptor and you're going to
Mhm.
take little tidbits from each person and then
Yeah.
kind of make it into your own. But usually I always tell everybody is like, yes, go in. You're going to look at the ER. Why did they come in through the ER? Why are they being admitted? Then you have your H&P that the doctor tells you, and it kind of
Yeah.
gives you the plan. But you also have something that's called like the medical prognosis note or the doctor physician prognosis note. And down at the bottom, it gives you assessment and plans. You have an idea, so it kind of matches up with what the nurse may have given you or may have not and
Yeah.
miss. Then, yes, I recommend looking at the labs for today. Sometimes the labs are not ready, but if you can
Yeah.
learn out the chart that you have the white count, the H&H, and then the platelets, and then
Yeah.
you have the EMP one that you can write it down so you can kind
Yeah.
of compare so you know, or you click through everything so your labs come up like for today. So then you
Yeah.
can compare and be ready. Then
Yeah.
I also tell everybody to go look into their like latest radiology. So if they had a chest x-ray, they had some kind of testing or whatever. So you have an idea. Because one of the most common things that I give everybody is that like they came in for pneumonia. They came in for a COPD exacerbation. Something that I keep trying to get them to understand is that the concepts of what we learn are always the same. I
Mhm.
talked about a care plan. The other day, I had a question that was brought up about care plans. What are they? Like we do this big 30-page care plan,
Yeah.
and like, you sit there and you do all this work for hours and hours, and then you hand it into your professor, and then they're like, "Good job," and you're like, "I spent hours on that." Like you have nothing to say, and then
Yeah.
when you get into the bedside, everybody feels like that goes away.
Yep.
like there is no more care plans. And I think they miss the concept to say like the whole thing is a care plan.
Yeah, it's embedded into it all.
Yes, people don't realize it, like that's what it is. So with me being a legal nurse, I start printing out stuff because I have to see where the deviations of standard of care are.
Yeah.
So I start printing all of it out, and I realize like right in front of me, there's a 30-page care plan. So the nursing diagnosis that we learn, we have those concepts that we get that the patient who comes in with the pneumonia, we're going to have an impaired gas exchanges. So it's looking at your doctor's order. So that's the number one thing I try to tell all the new nurses to establish that strong foundation is look at your orders. That is what is the doctor's telling you to do.
Yes.
Would you agree with that?
Yes, definitely. And it's important when you're getting report, you say they have a Foley. How many times have you had a patient with a Foley and no order, and you've got to correct that because that is the care plan. If it's not there, you're not technically supposed to be doing it. So
Yes.
I think that is super important.
Yeah, I don't think everybody understands. I had a student the other day who was like, the patient asked to shower and I let them. Well, like, what? Wait, what? You did what? No, we need an order for that. Even just to shower, like the simplest little things they don't realize. Once you step into the hospital and you're in that bed, everything changes. Like we just think we're going to go into our medicine cabinet and get Tylenol because we have a headache, where we have to have the orders from the doctor to say it's okay. Reason being that this is where I try to teach nurses the bigger picture of what if they have liver issues? You can't really give Tylenol. Same thing with Motrin. That is why I always say that you need to know what you're giving and why you're giving it.
Yes, exactly.
So given the high stress nature of nursing, can you share effective strategies or personal tips to managing stress and avoiding that big burnout? That is like, I'm watching TikTok, I watch all the videos, and one of the main things that comes out is that it's a burning out job because of COVID.
Yeah, I mean, I think not to the level of COVID, but even pre-COVID, we talked about burnout. There were days where it eats away at you and you go home so stressed, and then you can't sleep and you're worried about your patient. And how can you do that day after day? And then you add COVID to the mix and it magnified it by like 100, if not more. And so I think it's something that I probably struggled with as a new nurse. And I think I brought home my stress more than I should. And I didn't know how to handle that. I remember my first couple of patient deaths and how sad I was. I mean, it is a very sad thing, but I remember having a really hard time with it, a much harder time than I would have expected. And I think, at almost 12 years in now, I've gotten a lot better at that self-care. I recognize when I'm starting to spiral a bit and when maybe I need to take a step back and take a deep breath, or, figure out how do I squeeze in time for that lunch break. I know it feels impossible right now, but I also have to eat. So I've learned as I've gotten a little older to make that time for that break, even if it's only 10 minutes. Taking that break is important. And then once you're home, doing your best to decompress. Some of my favorite self-care right now is acupuncture and red light therapy. I find them both to be very relaxing. It's me time. Like I'm in a room either alone or with the acupuncturist, and like no one else matters in that moment except me. And I think that's important for us to do sometimes as nurses, make us the priority.
Yes, definitely. That's something I teach. So I have the new Nurse Navigator, which is a 7-module course that I have created. I have found that a lot of nurses who have experience, like you're talking about, that they don't need the time management, the delegation. I always talk about you have to have the contingency plan, like of emergencies, like you said. The shift can go very smoothly, but you have a plan for that emergency that may or may not come up because you don't know. But I pulled out the work-life balance because each module is different. And then work-life balance, I talk about grounding yourself, taking your time, because we hold so much emotions in us, and then we pick up, because nursing, we're very empathetic towards people. So when we hold on to that, and like you said, that first patient death, I try to prepare nurses to say that when you give that last dose of morphine and that patient passes away, that's devastating.
Mhm.
And you start to learn to see that when to give this. I prepare the families to say, this will be the last dose, or you just start to
Yeah,
see it, or you just give it, and a newer nurse would give it and walk out of the room, and next thing you know, the
yeah,
family's coming to the nurse's station to say
yeah,
mom died. And you're
yeah,
and you're like, what? It's not expected kind of thing. And then
yeah,
dealing with that, you're like, what do I do? So I definitely agree. I actually do acupuncture myself.
yeah.
Yes, I have learned to teach everybody to say, be within that moment and know that it's just about you. Because
Mhm.
we sit here and have so much on the outside noise that goes on, and we hold on to it, and we have to take those moments. So you
Yeah,
were talking about this red light therapy. What exactly
yeah.
is it?
So it's actually been around for years, but I think it's becoming more and more popular. I've heard so much about it in the last 6 months, but in this area, there really wasn't much red light therapy. And there's this amazing woman out in Northborough. She owns a business called Red Light Therapy for You. And she had a frozen shoulder and she just wasn't getting better. She was doing PT, she was taking medication. She didn't want to rely on things. She looked into red light therapy, found there's places in Boston that do it. So twice a week, she was driving all the way out to Boston to do this. And within about 6 weeks, she was so much better. So she kept doing it, was going to be going back to her corporate job and was like, I just don't want to. This is not where I'm passionate anymore. And she opened up this business about 2.5 years ago. And then others in this area have started to follow suit or adding it on to various things. I have a friend that has a med spa and she's purchased red lights for that. Um, but the theory behind it is that it's very healing. So you can do it from localized on one body part to full body. Um, and it's supposed to help basically repair the mitochondria. So it's helping your body at a basic cellular level to be stronger and healthier. So inflammation is a really it's so disruptive to the body, and red light therapy can directly influence that and reduce the inflammation. And it's 20 minutes tops. The only things to be aware of with it is that you can't go too often and you can't go too long. So I think you probably can do more than twice a week, but a lot of people recommend starting with twice a week. And Jean out in Northborough, who is very up to date on all the latest research, really tries to personalize that when you first come in and see her. So my first time with her, she was like, I'm not ready to let you in here for 20 minutes. Like, I know you've been doing it here and there at other places, but I want to start you at 14 minutes and see how you feel. Because I had shared with her at a different location, I started to get sweaty during red light therapy. And she was like, oh, no, 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 I don't want you to get sweaty. That's not effective. So she really personalizes it because she's so up to date on this therapy and she really believes in it. And I notice I leave there feeling really relaxed. It helps my mood. I find myself getting less anxious, less stressed out. And then my body just feels really good on top of that. And my skin looks good. And um, so I don't know. It's this up and coming treatment that seems very promising with almost no side effects. So
Yes, when I do my acupuncture, the acupuncturist actually does that on me. She has a
oh,
whole, so
awesome.
she can't puts both of them together.
That's
So
amazing.
I know a lot of listeners out there don't have access to a lot of this stuff. So I started teaching that you have to take moments to yourself.
Mhm.
And the easiest time to have that moment where you don't have any distractions, I always say it's in when you're taking a shower. You get out of work, you feel gross, you need to
Yeah.
take a shower. So I always say that water is emotion because we go to the beach, we feel great, the sun, everything. So if you don't have access to any of this, I say when you get into the shower, you're going to think about the day. Some
Mhm.
situation is going to be in your mind. So I always say that you have to take that and then you sit with yourself and you say, like, what is this trying to teach me? Even if it's outside of nursing and it's a personal situation you're dealing with. And I always say that you got to ground yourself. So I always picture like a ball in my stomach because that's usually where it sits because we have that
Yeah.
upset stomach that gets us. And I
Mhm.
always say, try to push it down and wash it down and say, this is not my emotions, my feelings, everything, and try to wash it down the drain. And
Mhm.
some people have a really hard time doing that. So I always say timelines. I say you take a 5-minute shower, let's just say. So you're going to give it that 5 minutes. But I give people, I say 48 hours, but it's not the 2 days because you can't get
Mhm.
over something in 2 days. It's sitting with it. So actually setting a timer or writing down in a journal to say you
Mhm.
sat with it and what is this trying to teach me? And then you move through it because you have to move through the issues because they don't just go away. They always come
Mhm.
back up. That's why you're like, I've had it up to here with X.
Yeah, because
And
literally
when
you
we
have.
do that, yes. So I just say that we have to push it down. So if you don't have access to acupuncture, because all that costs money.
Mhm.
So we have to find modalities that can be done quickly and for free and teach you to say that you self matter. Because I
Yeah.
always tell my patients, like, I'll have the wife sitting next to the husband in bed, and then
Yeah.
she's like, oh, this, that, da, da, da. And then she leaves, and then you talk to the husband, and he says the same thing. Oh, she's this, she's that. And then I'm like, you can't help take care of her and her stress until you take care of yourself. And I
Yeah.
always feel like this is a little tune up for your body, but you need to be well before you can help anybody else. And I realized in the last 2 decades of working at the bedside, teaching, and being the legal nurse, all the stresses that we have. And yeah, just
Mhm.
finding that self-care of whatever it is. Because some people say, I go and get my nails done, I get my hair done, because they do like having those
Yeah.
mindless conversations sometimes with
Yeah.
people. And it's whatever works for you to help you avoid that burnout from being a nurse. Because
Yeah.
I can say that it's working the bedside and doing the job itself is not hard. I find joy sitting there listening to the stories that the patients tell
Mhm.
me and how they got where they are in that moment.
Yeah.
But then
Yeah.
I do realize that, like, I have to separate myself because I used to be able to say we have bags, like our bag of stuff,
Mhm.
you carry it around with you. And I was so good at leaving my bag, leaving myself at the door, going into the room or going into work and focusing on everybody else. I pick my bag back up and then I go home and the stuff that I
Mhm.
have in my bag is still there. And I haven't
Mhm.
dealt with it. It's just that I'm
Yeah.
learning to compartmentalize and put it in different sections. But when I pick my bag up and it's just me, I have to deal with what's in it.
Yeah.
So I definitely agree with finding the acupuncture. I'm happy and awesome to hear about that red light therapy. Like,
Yeah.
yes, I do feel like I have a different feeling towards it, but I'll
Yeah.
be interested to check that out and do one whole red light therapy and like just
Yeah.
I'm excited.
Yeah.
So, moving on. So, nurses require excellent time management and then prioritization and skills. So, what methods have you found that most effective to manage your workload? Like, especially when you face like unexpected challenges and like emergencies that you talked about.
Yeah. So I remember when I was precepting as a student nurse, I wasn't an RN yet. I had a preceptor that we would get report and I'd hold all my reports in my hand and she would say to me, what patient do you want to go see first? And I'm like, I felt like it was a little quiz. It was a little intense, but it was a great experience. And I would go through my papers and I'm like, I think we should see this one first. And she would say, why? And I'd tell her why. And I'm sure there was times where, she was like, no, we're going to go see this one first, but it helped me to develop that skill. So I remember at the start of every shift, without my preceptor, years in, 12 years in, I will still kind of do that. I will sit there with all my reports and be like, who do I need to see first? And I'll kind of make a plan as much as you can make a plan for the day. I feel like because nursing, especially in the hospital, it can change in a second. You
Mhm.
have to you have to go in it ready to go and just be prepared to start working so that when things do get chaotic, you don't have all this stuff piled up over here that you still haven't done that you could have been doing for the last 2 hours. So I
Right.
try to prioritize who I'm going to see first, get all my assessments done, depending on if I'm, days through to 11 nights, decide, what I need to do with meds. What can I combine? If they have an 8 o'clock, a 9 o'clock, and a 10 o'clock, why don't I try to get it all done at 9? Because I can't realistically go in that room 3 times in that short time just for medication. Maybe they need something else, but I can't. That's just not practical. And we're taught that to try to combine what we can.
Yeah.
So I think that's how I try to manage my time, is get as much of the I need to do this done right away so I can deal with the chaos later, like that change of shift code that seems to happen all the time on 3 to 11.
Yep.
If you've had a bad day and you haven't done any of your documenting yet, and now you have a change of shift code, well, you're probably not going home till like 2 a.m, and that's no fun. So
Yep.
I do really try to.
Yeah, I definitely agree with that and having that plan. Part of like with the course, we work out that with time management. That's something that I really like to hone in and teach the new nurse. One, I always say be patient with yourself, because it takes up to average of 63 days to actually get a habit. And then, like you said, you take a little piece of each preceptor, because I always say you're not going to feel confident in yourself for at least 2 years.
Yeah.
And even now, sometimes you walk in and you don't have the same situation and things come up, and it's okay to ask the question going,
Absolutely.
I'm having a brain fart. It's been years since I dealt with this. Can you just, and you have that person that you build those relationships with, that you're able to go ask those questions.
Yeah.
I always say, don't be afraid to ask those questions.
Absolutely.
But I always say to give yourself the time to build that and make that plan. So yes, it's like once you get those vital signs, that's where I would sit down too, to say, who am I going to go see first? Because it's depending on, that's the simplest thing as the nurses can do. You have your nurse's aide. On our floor, we did our own vital signs.
Yeah.
So I was able to walk in to the patient's room and kind of get an idea. Two, when you get your report, that's going to give you an idea of who you're going to see first. The number one thing I try to tell new nurses is that, do you have a patient who has swallowing issues and they need their meds crushed? Those are the ones that you want to keep for the last, so you can actually spend more time with, compared to the nurse, the patient who only has 2 or 3 meds that you can get out of the way quickly. And I always say that that's the time that you're going to go in, you're going to do your head to toe assessment, you pass your meds, and then you see what do they need in that moment, but they have dressing change. Remember, we're going to look at our orders. I'm going to do their dressing change after, but you're going to communicate that with the patient to say, I will be back in to do your dressing later, blah, kind of thing. And then you just kind of keep moving on. Our papers, we write all that down. So after I see everybody, that's when I recommend to say, take that 10, 15 minutes, whatever, and you start documenting at least your head to toe assessment in the computer. Is the best thing I can say to everybody. Writing your shift notes, that can come later before you go to lunch or at the end of the day, like you do your 2 o'clock rounds, because I usually work days. The 2 o'clock rounds is when I go around and I check in on everybody, because it's the end of the shift. So you make sure that they're doing okay.
Yeah.
Because I found when I read the legal nurse stuff, the most common words is like patients resting in bed with their eyes closed. Then the next nurse comes in and that patient's dead. That's the lie.
They weren't resting.
They're not resting, So I always say, don't write that. There's different things that I teach to say what is the proper thing to document in a shift note, but we're going back to the prioritization and being ready for any emergency. So it's taking that 10 minutes to just document that shift assessment for each patient. So then it time stamps you and you get into a habit of doing it. So it becomes part of your flow of what you do during your shift. So then you have it ready, that you already have it written down. You already did that task. So it's easy to just kind of plug in. If you don't have time in that moment, it's a busy shift, or like you said, that change of shift code that happens, but at least have your head to toe assessment in, and you documented that your meds are done, your IV is flushed, and you have that in. That's the basics. Everything else you'll be able to button up, because if you have someone working with you, this is where I talk about delegating and delegating tasks to that CNA that you have, or whatever you call them in your hospital setting, your facility, that they did the eyes and O's. So you
Mm-hmm.
have to make sure, like I always tell, have a check box. Get a
Mm-hmm.
little box and check yourself. Like I did my head to toe assessment, check. I checked my eyes and O's, check. I did this. So at the end of your shift or before you go to lunch, whatever way you prioritize yourself, that you know that you like matched all your tasks up
Mm-hmm.
and you're all set.
Exactly.
So I know we just talked about importance of building relationships within the workplace and colleagues and mentors. So how can you like give advice to a new nurse to foster those relationships from the start?
I think the biggest thing is you can't be afraid to ask questions. And I know you did already say that, but it's something that when I am precepting a new nurse or working with a new nurse, I make sure they know that asking questions is a good thing. If you don't ask me any questions, if you're a new nurse and you go through your whole shift without one question, I'm worried about you. But if you have the sense to be like, hey, I don't understand this. Can we talk about this? Can you explain this to me? Or can you help me with this? I'm going to worry less about you because I know you're going to come to me or someone else if you need something. Because as a new nurse, you're supposed to have questions.
Yes.
So I think that's the best way to build relationships. And I can think of an example when I was a student in a rehab. It was my very first clinical. It was in a situation where some of our classmates got the acute care setting and we were in a rehab and people were disappointed. And why does some people get to go to Mass General and here we are at rehab? And I'm like, guys, it's still a great learning opportunity.
Oh, I say that all the
And
time.
I made friends with the nurses. I would go around and ask them like, what can I help you with today? Or, hey, I was looking at this on the patient and I don't understand it. And I developed this great relationship with the nurses on the rehab floor to the point where when they get something cool, they would come find me. They're like, do you want to do this with me? I'm like, yeah. And
Yeah.
so I learned so much in that time. And when I went back to my classmates, the ones at Mass General and all that, their hands were tied. Like those patients were so acute and we were in our very first clinical. So they weren't given the opportunity for a lot of hands-on care. And I got to do all sorts of things that I otherwise wouldn't have had the opportunity for. And I think, building that relationship with the senior nurses, it really puts you in a great position to learn and it makes them respect you too,
Yes.
you know?
Oh, definitely. Because I agree with like if you're not asking questions, I'm very worried.
Yeah.
If you don't, the easiest way to describe it is like you come across cocky, like you think you know everything.
Yeah,
After being a
absolutely.
nurse for 2 decades, I'm like, I don't know everything.
Yeah.
Like I
We have
can't because
questions all the
each
time.
each situation is different.
Yeah.
Like I said, this is where I go back to the concepts are the same. I teach LPNs and I always say to them, I don't need to teach you how to do a head to toe assessment. I don't need to teach you how to pass meds. I just need to teach you the concepts of why you're doing what you're doing.
Yeah.
Why are you giving this med and what are you going to expect from it?
Yep.
I don't know if you found this is the newer nurses, it's like they just think vital signs are vital signs. Like they take vital signs and don't think anything of it after. Because I
Yeah.
was like, okay, what's your blood pressure? Your blood pressure was high. What are we doing about it? And then
Mhm.
they're like, oh, we're going to give the meds and we're going to give beta blockers and we're going to do this. And this is what you look at. And they give you all that stuff. Right. And then the shift goes on and we make plans to say, hey, I want you to make sure you recheck the blood pressure. You're doing this, you're doing that, doing this for this patient. Okay, let's move that. You're doing this, 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 this. Then when we check in again later, okay, I go to tell me what happened when you did XYZ. And oh, I didn't do that. What do you mean you didn't do that? We talked about it like an hour ago that you were going to do it.
Yeah.
And you said you were all set. And you like, what happened? And it's all the time. And they got distracted with something else. And I said, that is where you need to prioritize yourself and write it down and follow
Yeah.
your list. So you build your flow. And then you talk
Yeah.
about something like going back to like, who do you see first?
Yep.
Like I had that. It was so funny. I started and the nurse asked me that question. And I said, oh, I'm going to go see Sally first because she's a diabetic and I'm worried about, making sure her blood sugar or whatever is okay. Where they're like, well, let's look at the vitals. What's wrong with these vitals? And I was like, well, the temperature is really high here. So you're going to go see that patient first.
Mm-hmm.
Oh, well, you're not worried about the diabetic with their breakfast tray? You're like, The aide is going to be going to get the blood sugar, and they will come to you with it. And then that's where you're going to say they need it or not. You can't just assume that the diabetic, they're going to be up or down. This is something they deal with all the time, unless they're a new diabetic. And if they're a new diabetic, we know their blood sugars are going to be high. So they're going to take it. And then not even that, we know we have to spend time with that patient to teach them.
Yes.
Because they need to get their blood sugar. So that's a whole different scenario. Like, I start with my students and I give them, okay, you have a patient who complains of like chest pain. You have a patient who has the blood sugar of like 43. And then you have a patient who needs to go for a test. Who do you see first? What do? You know?
Yeah.
And I sit there and I say, okay, this is where you use your nursing delegation. You have the communication with other nurses saying, this is my scenario. Hey, can you help me? The patient has a blood sugar of 43. Are they talking? Because you'll be amazed with some people with blood sugars that low and they're still talking to you. School scares you to say, oh my God, they're going to be in a coma and this and that. And it's different. Same thing with that patient with the chest pain. And you look at their telemonitor and they're in VTAC. And they're VTAC. We need to go shock them. And I'm like, nope, Sally's just there talking to us and hanging out. I said, that does not mean anything. And like, you'll start learning those scenarios that you're in, because school freaks you out sometimes with all the different stuff that you're going to come up with. And then when those scenarios are in front of you, you're like, what do I do? And that is where I say, ask the questions.
Yeah. And it's just like they taught us in school, you know, so the monitor is showing you this, but what is your patient showing you? Okay, so the pulse ox is reading at 75 and you walk in the room and the patient's totally fine. Let's readjust that pulse ox and see what it really is. It's not 75. So it you know, it just goes to show you have all these data points that you're looking at, but you have to look at the patient too.
So the last kind of question that I come up with is, so healthcare, as we talked about, is continuing, evolving, and changing. So how would we sit here and tell new nurses to learn and improve? So this is where I say I come in and I have the new nurse navigator that I created that I want everybody to kind of go and check out. So if you do go to educationalnurse.com, you have the resources there, and you do get into a private community where we ask the questions and we talk like this to give the nurses the opportunities. Is there any other specific resources or practices or mindsets that you would tell these nurses to help them stay informed?
So I think it was probably early on as an RN, I signed up for Medscape, and I've taken it a little bit of a step further now that I'm in NP school, but I get notifications to my phone about new studies or whatever it might be. And you can focus it. You can choose it to be, you know, cardiology or oncology or whatever you want. Mine being a cardiac nurse, it's cardiology. And I'll get articles about, you know, oh, there's this new study now that we found patients with preserved EF actually don't need to stay on a beta blocker after a year after having their MI and things like that. And it's great to read those articles, and then you look at the data and it gets your mind thinking and you can discuss with your colleagues. So I love seeing new research studies. That's one of the ways I stay informed. And we do so much research while we're in school. And I think we get out of school and we're like, oh, I'm so done with that. I don't want to do that. But I'm kind of the nerd and I love it. And so that's one of the ways I've stayed up to date and continue to learn is by reading those articles. And then I can bring that back to the team or discuss it with, you know, someone's provider, and maybe we can make treatment goals based on that if it's proven research, you know.
Yeah. Also, too, is going back to when we're talking about prioritization and looking at like the medical stuff. So that practice note, and it's what's the plan? And this is where I say ask questions, because you're going to read that assessment and plan, and the doctor's going to recommend X, Y, Z. And you need to know why we're giving what we're giving. A perfect example I give of this is that, okay, we go back to our labs, and let's just say our sodium is high. It's 152. You should already know that the doctor is going to be ordering fluids. And what kind of fluids? This is your D5W, and this is when they have to go to the hypotonic, so it's the 3% normal saline to help bring that down. And that is why we talk about hyponatremia or hyper in the treatments. And then not even that, what is your patient going to be like? Are they going to be alert and oriented? Are they going to be confused? Are they going to have swelling somewhere in their body, edema in their legs? Because if you go back to CHF and the EF that you talked about, which is the ejection factor, so basically it's the amount of squeeze your heart gives to pump to the rest of your body. Because I know some people might be asking, like, what is that? So we do talk about stuff like that. And that's what we always ask to bring into the community, and know that this is a private community, that you're able to ask those silly questions.
Yes.
And I find that sometimes you're embarrassed. Like, I like to teach in school to say no question is a stupid question.
Absolutely.
Like, you need to ask these questions. I had a student the other day who was like, they were giving insulin, and they're, can you check this? Our new nurse. And I was like, yeah, no problem. So you walk in and I check it. And then all of a sudden I go, why are you giving 50 units of Humalog? I don't know. That's the doctor just ordered it. That's what the doctor said. And I go, okay, what's the patient's blood sugar? You don't know? What do you mean you don't know? Okay, what's the patient here for? Abdominal pain? Do they even have a history of a diabetes? No. So why are you giving this? So this is where I say you need to go have a conversation with the doctor. You can't just sit there and give it. So they're sometimes scared, embarrassed, or whatever. So I said, come with me. So we go into the back and we say to the doctors, we're friends. So you say, hey, John, can you answer a question for me? Yep. So we have a patient here in room whatever it is, and we're going to be giving 50 units of Humalog without knowing what the blood sugar is. They're here for abdominal pain, and they have no history of diabetes. The doctor jumped up. What? Wait, that's the wrong patient. Oh my God. Thank you for bringing that to my attention. And as a new nurse, you don't know that. So that is why I say, ask the questions, even to the providers, to say, why are we ordering this? This makes no sense. Same thing with, you could say, okay, they have the high sodium, and you're expecting an order, and it's totally different. And this is where the literature comes in to say that this is the protocol now of why we're doing what we're doing. So then it makes sense. So it's okay to ask the doctor, hey, what's your thought process on this? Why are we doing what we're doing? And this is the pathophysiology of, I get books that I sit and study. So what I always tell the new nurses is that during your shift, you have a little notebook. I can't say this enough. And things and scenarios that come up, or I always try to challenge the nurses saying, what is the EF? Tell me about it. I want you to teach me. Because I feel like if you can't teach it, you don't know it.
Exactly.
So I say, find out what it is. You need to be able to speak to this. And then, like I said, it's the same thing. It never changes. The concepts are always the same. Patients and scenarios are going to be different, but the concepts are the same. So we have hyponatremia, and we're going to have an idea of what we're going to be doing.
Yep. I think that's great. I think going back to the physician order, I think it's so important not to be afraid to ask the physician for clarification. It's their license. It's your license. You might get the doctor that's frustrated with you, but you have to remember that's on them, not on you.
Yes.
9 times out of 10, they're either going to say, thank you so much for bringing this to my attention, or actually, this is why we're doing it, and they're going to teach you.
Yes.
So you can't lose by asking for clarification.
You can't lose for asking questions. So I guess that's the biggest takeaway from our today's podcast is that the handbook is, you need to have a plan. You need to sit there and ask the questions and not be afraid. And like I said, go to educationalnurse.com and get into pick one of them. There's the New Nurse Navigator. I have the work-life balance that we teach you, and Ashley and I can talk to more about what the red light therapy, acupuncture, all of it, because we are going into more different things with women's health, because that's one of the things that we're talking about now, to say that that's a big fault, or not really fault. I'm not sure what a word I'm looking for to say that for women in today's health, it's very down here. Like, they don't really care when you complain about something. Yes. So that is going to be our next steps in future podcasts from here that we're going to talk about. If you do have questions, leave them in the comments for us to answer them. And we're looking forward to you in the next week's podcast and everything else. So Ashley, thank you so much for this time. I really appreciate it. And I'll see you. Let's book like next week. We're saying next Friday again. I know Tuesday, the 29th, we're talking about going to our Wednesday. So everybody knows we're on a schedule. But we're
Yeah.
saying next Friday around 10:30 again.
Yeah, absolutely.
All right. I will see you then. I hope you have a good day. And thanks for
Thank you
chatting.
too.
Okay.
Bye.